Hi, I'm Dr. Kiran K J. I'm a senior consultant in Department of GI, Minimal Access and Bariatric Surgery. Today's topic of discussion is hernia. So, a lot of patients come to the clinic or to the OPD or will meet some other doctor telling, sir, I'm noticing some swelling in some part of the body, in my tummy, in my groin, in my any part. Like might be they were incidentally when they go for endoscopy, they may pick up they are given something called as hiatus hernia. So, a lot of people come with this kind of presentation to general practitioners or to me directly. So basically, it is a defect in our abdominal wall through which any viscera like intestine, stomach or omentum can come out and pop out whenever they strain. So this is called as hernia. This is a mechanical defect. So a lot of patients will ask us, sir, is there any medicines for this? No, this is a mechanical defect. Surgery is the only solution, and preferably in elective phase. A lot of people, in spite of advising you have to go for surgery, they neglect and they come back in emergency phase. And in emergency phase, it's at its own more is a risk to the patient rather than to a doctor, because we are used to operate both emergency and elective surgeries. And in hernia, when you do emergency surgery, we can't put the mesh because the bowel might have been infected or it may have been gangrene. So a lot of fluid may be there in the sac, so which will cause secondary infection of the mesh, which will be one more detrimental thing. So in emergency surgery, we usually don't put mesh, and the probability of again the hernia coming back is more. So whenever you notice any swelling in any part of the body, please take attention of a surgeon. And most of the time it should be a hernia. If it is not hernia, then it can be some benign swellings like lipoma and all. But usually whatever you notice in umbilical region below or above the umbilicus or in the groin, it is called as, usually it is 90% is an hernia. After you meet a surgeon or a clinician, we examine and we have something called a scoff impulse, which we notice when we examine you. So once we diagnose this as hernia, yes, definitely we recommend you to go for surgery, because this is a mechanical defect, it has to be repaired. And usually the best method to treat this hernia is laparoscopic way, because you come the day of surgery in the morning in empty stomach, we do the surgery and we can send you back the next day morning. So we also call it keyhole surgery or minimal access surgery. Patient can sit in the evening after the surgery very comfortably and will be able to ambulate or walk in the same evening, and the quality of life is much better in laparoscopic repair. Yes, open is indicated in high-risk patients where they are not fit for general anesthesia, might be elderly patient or those with lung disorders or those with cardiac problems. We have to give a regional anesthesia, that is spinal anesthesia. In those cases, we have to do open procedure. Any patients come with hernia, we say one and only answer is hernia repair, and preferably laparoscopic repair. And we put a mesh because it gives additional strength to the repair. So a lot of people say, what quality of mesh you put, mesh is really indicated, and all those etc. questions. So definitely, whenever we put if you consider you are filling a hole in your wall or anywhere, you fill with the brick, and above that you give a cement, that is called as mesh. We reinforce that correction with a mesh, so that will give additional strength, and the probability of recurrence is exceptionally low. So the type of mesh we put is usually Prolene mesh, which is a synthetic mesh, except there is a situation where we repair laparoscopically umbilical hernia or any ventral hernia of the abdomen. We put a biomesh from inside. In that case, we use biomesh, which will be slightly costlier than Prolene mesh, but the quality of the mesh is quite good, and we do only based on case scenario. Ideally, if we do laparoscopic extraperitoneal method, that is, we don't go through the abdomen, but we go above the layer of abdomen, there we put a synthetic mesh. So you need not worry about the mesh, doctor's choice. Based on the surgical scenario, we put the mesh, and mesh is must again. So laparoscopic mesh repair is the answer for hernia repair. There is no other medical treatment or a consideration. Thank you.